Welcome to today's lecture on gynecologic emergencies. In this session, we will cover common gynecologic conditions, their causes, patient assessment, and emergency care strategies. Understanding these emergencies is crucial for providing effective pre-hospital care. Gynecologic emergencies have a wide range of causes, from infections and sexually transmitted diseases to trauma. These conditions can significantly impact a patient's reproductive health and overall well-being. As EMTs, recognizing and managing these emergencies early can make a major difference in patient outcomes. Pelvic Inflammatory Disease, or PID, is an infection of the upper reproductive organs. It almost exclusively affects sexually active women and can lead to serious complications, such as ectopic pregnancy or infertility. The most common symptom of PID is generalized lower abdominal pain. Recognizing PID early is essential for preventing long-term reproductive damage. Many sexually transmitted diseases, or STDs, can lead to more severe health issues if left untreated. Chlamydia is the most common STD and is caused by bacteria. Often, patients have mild or no symptoms, which means it can go undetected and progress to more severe conditions like PID. It is important to be aware of STDs as potential underlying causes of gynecologic complaints. Bacterial vaginosis is the most common vaginal infection, affecting women between the ages of 15 and 44. This occurs when the normal bacteria in the vagina are replaced by an overgrowth of other bacteria. If left untreated, it can lead to complications in pregnancy, such as premature birth or low birth weight, and it may also result in PID. Gonorrhea is another common STD that rapidly grows in warm, moist areas of the reproductive tract. In women, it affects the cervix, uterus, and fallopian tubes, while in both men and women, it can infect the urethra. If left untreated, gonorrhea can enter the bloodstream and spread throughout the body, leading to more serious systemic infections. Vaginal bleeding can result from a variety of causes, including abnormal menstruation, vaginal trauma, ectopic pregnancy, spontaneous abortion, cervical polyps, or cancer. Identifying the source and severity of the bleeding is critical in determining the appropriate course of action in the pre-hospital setting. A thorough patient assessment is key in gynecologic emergencies. In the field, you will often only be able to form a primary impression, but a detailed assessment helps determine how severe the condition is and whether life-saving interventions are needed. Scene safety is critical in gynecologic emergencies. Be prepared to encounter large amounts of blood or body fluids. If there is suspicion of assault, law enforcement should be involved. In cases of sexual assault, it is preferable to have a female EMT provide care when possible. Scene safety is critical in gynecologic emergencies. Be prepared to encounter large amounts of blood or body fluids. If there is suspicion of assault, law enforcement should be involved. In cases of sexual assault, it is preferable to have a female EMT provide care when possible. Begin by forming a general impression of the patient. Assess whether they are stable or unstable, and use the AVPU scale to determine their level of responsiveness. Always prioritize airway and breathing to ensure the patient is oxygenating properly. Circulation should also be assessed, including pulse, skin color, temperature, and moisture, to identify any signs of blood loss or shock. While most gynecologic emergencies are not immediately life-threatening, signs of shock, such as low blood pressure, rapid pulse, or altered mental status, require immediate intervention and rapid transport to the hospital. When obtaining a history, investigate the chief complaint. Many questions may be personal, so ensure patient privacy and dignity throughout the assessment. A calm and professional approach will help the patient feel more comfortable sharing critical information. For abdominal pain, ask about its onset, duration, quality, and whether it radiates to other areas. Also, inquire about factors that provoke or relieve the pain, and ask about associated symptoms such as nausea, vomiting, lightheadedness, or fever. For vaginal bleeding, ask when it started, how long it has lasted, and how much blood has been lost. One way to quantify blood loss is by asking how many sanitary pads have been soaked. Symptoms such as dizziness, fainting, or lightheadedness can indicate significant blood loss. A sample history is especially important in gynecologic emergencies. Ask about birth control use, pre-existing medical conditions, and the date of the last menstrual period. This information can help determine potential causes of the emergency. A secondary assessment should include vital signs such as blood pressure, pulse, and skin color. Orthostatic vital signs can help identify significant blood loss. Abdominal tenderness, visible bleeding, and mental status should also be evaluated. Physical examinations should be limited and professional. Only examine the genitalia if absolutely necessary to provide treatment. Keep in mind that older patients may have gynecologic concerns related to hormone replacement therapy, cancer, or pelvic floor disorders. For patients experiencing vaginal bleeding, use external pads to absorb blood and assess for discharge. Symptoms such as syncope, fever, nausea, and vomiting are significant and may indicate more severe underlying conditions. Continue monitoring the patient's heart rate, respiratory rate, blood pressure, and skin condition. Consider non-invasive blood pressure monitoring for patients with suspected severe blood loss. Always repeat the primary assessment. There are few pre-hospital interventions for gynecologic emergencies, so monitoring for changes in condition is key. Communication with hospital staff is essential. Be sure to include any possibility of pregnancy in your report. In cases of sexual assault, thorough documentation is crucial for both medical and legal reasons. Maintain patient privacy as much as possible. If in a public area, move the patient to the ambulance to provide care in a more private setting. When possible, have a female EMT participate in the patient's care. Use sanitary pads externally to absorb blood and document the number of pads used. Keep in mind that injuries to the external genitalia can be extremely painful due to the high concentration of nerve endings in the area. For external lacerations, apply moist, sterile compresses. Do not attempt to pack or place dressings inside the vagina, as this can cause further injury or infection. Pelvic Inflammatory Disease, or PID, is a common cause of gynecologic emergencies. Patients with PID typically present with lower abdominal pain, which often begins during or after menstruation. The pain may worsen with movement, such as walking. In the pre-hospital setting, treatment for PID is limited. However, recognizing the symptoms and providing supportive care is important. Non-emergency transport is usually recommended unless the patient is showing signs of severe infection or complications. Sexual assault and rape are unfortunately common occurrences. Studies show that 1 in 5 women has reported being raped, and 1 in 3 will experience some form of sexual molestation. As an EMT, you must handle these cases with professionalism and sensitivity, ensuring that the patient receives both medical care and emotional support. As first responders, you may be the first person the victim speaks to after the assault. Your demeanor and approach can significantly impact their emotional recovery. Always display kindness, patience, and respect when interacting with sexual assault survivors. Provide reassurance, but avoid asking unnecessary or invasive questions. Some sexual assaults involve the use of drugs that impair memory or consciousness, making it difficult for the victim to recall the incident. Be alert for signs of drug-facilitated assault, such as confusion, drowsiness, or an altered level of consciousness. If possible, offer the option of being treated by a female EMT, as this may make the patient feel more comfortable. When treating a patient who has been sexually assaulted, your focus should be on medical care, psychological support, and evidence preservation. Avoid unnecessary physical examinations and document only what is medically relevant. If law enforcement is involved, work collaboratively while prioritizing the patient's dignity and well-being. Encourage the patient not to shower, change clothes, or clean themselves before arriving at the hospital, as this could destroy vital forensic evidence. If clothing has been removed, place each item in a separate paper bag, never plastic, to preserve evidence. Follow local protocols regarding evidence collection and reporting requirements.